Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss planning a pregnancy, the Center for Disease Control 10 Steps for Planning a Pregnancy, and review the Center for Disease Control Pregnancy Planner. Planning to become pregnant while battling epilepsy is a big decision. Women who have epilepsy and become pregnant, their pregnancies are considered high risk. It is important for your neurologist or epileptologist to work with your OB/GYN as you plan your pregnancy, go through pregnancy, give birth, and postpartum care. Women with epilepsy should take all precautions to prevent unplanned pregnancy. Once planning to become pregnant, schedule an appointment with your doctors and put together a plan. Pregnancy is different for every woman, which is why it is important to focus on your overall health and make sure you are physically, emotionally, and mentally ready to conceive. We are going to review the Center for Disease Control and Prevention 10-step plan on how to prepare for pregnancy to learn what steps need to be followed to prepare for a healthy pregnancy. The CDC Pregnancy Planner reviews not just health, but lifestyle. Besides health, how are you financially? Do you have other important goals to complete before getting pregnant? These questions are important because as much as we feel we are ready for a family, something unknown can come up. I went to the extreme to create a financial plan to see what my husband and I made, how much our living expenses were, and created an estimate of how much having a baby would add to our expenses. It sounds like a lot, but it will save you a lot of stress in the future. What actions are you going to take to be physically ready? For example, the medication you currently take, what risks may come with it? Making sure you understand what triggers your seizures so you can avoid them. Making sure you are in a supportive environment as you go through your pregnancy. The most important thing is to work towards achieving overall wellness. Being physically fit is just a part of being well. You need to be emotionally and mentally well as well. Make sure you work towards finding balance and achieving overall wellness as you prepare for pregnancy. Seeing your doctor when you are planning a pregnancy is important. When choosing an OB/GYN, find someone who has experience with high-risk pregnancies, has good communication skills, and good bedside manner, and is ready to work with your neurologist or epileptologist. It is essential to put together a team that can work together so if changes need to be made to your treatment during pregnancy, everyone understands and agrees. Folic acid is a B vitamin that is used to help prevent complications during pregnancy. The CDC 10-step plan recommends 400 micrograms, but your doctor might put you on a higher dose during a high-risk pregnancy. When I was pregnant with my sons, my OB/GYN and neurologist had me taking 4,000 micrograms a day. I began taking folic acid and prenatal vitamins 3 months before trying to conceive to make sure the supplements were in my system and greatly reduce any complications. Most complications start in the first trimester, so it is best to start taking supplements before trying to conceive. Folic acid and prenatal vitamins should be taken throughout the entire pregnancy. Alcohol, smoking, and drugs can lead to several unnecessary complications. Complications such as fetal alcohol syndrome can occur when mothers drink excessively while pregnant. Smoking can lead to lower birth weight, preterm birth, and increases the risk of sudden infant death syndrome. Drug abuse can lead to the fetus being born addicted to drugs. Withdrawal is painful, and in some situations, the baby can have seizures while going through withdrawal. If you are battling drug and/or alcohol addiction or need help quitting smoking, seek help from your physician before trying to conceive. Avoiding toxins during pregnancy is important. Many household cleaners, cat litter, bug sprays, and lawn treatment can cause harm to the fetus. The link listed below is from the CDC website and will help you to find what you should avoid being around while pregnant. Maintaining a healthy weight can be challenging for someone with epilepsy. Many of the side effects of anticonvulsant medication are weight gain and weight loss. Speak to your doctor if you are concerned about your weight and how it can affect your health. The link listed on the slide is from Johns Hopkins Medicine and helps you to find what foods you should eat during pregnancy and what to avoid. Violence is something all women should avoid. Sadly, some women end up in relationships that lead to domestic violence. According to the American College of Obstetricians and Gynecologists, 1 in 6 abused women is first abused during pregnancy. Situations such as unplanned pregnancy, financial distress, and lack of attention can lead to partners abusing their spouse. There is no reason or excuse that justifies anyone being abused. If you are being abused by your spouse, contact the National Domestic Abuse Hotline at 800-799-7233 or 800-787-3224 if you are in need of help. Knowing your family's history is important. If your family has a history of a certain condition, it is best to see if your child is at risk. Many carry a recessive gene and are unaware of it. Along with having epilepsy, I am a carrier for hemophilia and did not know until my children were born. I had no idea what hemophilia was or that I even had it until my son started having complications from it. If you are unaware of any complications, have your doctor schedule genetic testing to see if there are any risks. Mental health is something our healthcare system needs to focus on more. Mental health is important, yet many have placed a negative stigma on it. If you are not mentally healthy, then you are not physically or emotionally healthy. Women with epilepsy are at higher risk for anxiety and depression. If you have a history of anxiety and depression, let your doctor know. Once you are expecting, do everything you can to focus on your overall health. Create a birth plan and go over it with your doctor. Communication is essential to have a healthy pregnancy and delivery. Hiring a doula can help relieve stress during pregnancy and be a coach for the mother while she is in labor. Make sure you are following proper guidelines and educate yourself as you get ready to bring a new life into this world. The CDC Pregnancy Planner, Steps to a Healthier Me and Baby to Be, is a great resource for women who are considering or planning a pregnancy. It is a step-by-step booklet that can help you see where you are and what changes you should make as you plan for pregnancy. Please visit the link below to download the checklist. In conclusion, pregnancy can be challenging for women with epilepsy. Proper steps need to be taken to have a healthy pregnancy. Women with epilepsy should avoid an unplanned pregnancy and talk to their physician about what contraceptives work best for them. When ready to become pregnant, talk to your neurologist or epileptologist and OB/GYN about what steps to take to become pregnant. The CDC Pregnancy Planner is a useful tool for women to follow who are ready to conceive. To learn more about planning for a pregnancy and epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos on our channel and subscribe today. You have the power to defeat epilepsy.